had never read a book about a woman neurosurgeon who was trying to be a mom and trying to be a wife and trying to be a good surgeon and going through this training phase. And when I got pregnant with my first daughter, Amara, I very vividly remember this episode I had, and I wrote about it in the book, about where I had morning sickness and I was doing a craniotomy.
That sticks out in my memory too.
And, you know, and when it happened, I thought, oh my gosh, like I've never read a book that described this. And so I started writing these stories in a journal, and I just collected, and they were handwritten, and I collected them and collected them. And then here I was, all of a sudden, I blinked an eye, and I was 5 years in practice. And I had all of these volumes of books, and I had also voice memoed myself.
Nice.
So I had almost 2,000 voice memos.
Dr. Sheri Dewan, welcome to the show.
Thank you so much, Victor. I'm really excited to be here and talk to you about the book and many other aspects of my life.
I think a lot of people are going to get a lot of takeaways from this in the sense of how you manage to balance, which is a common question you probably get, is like how you manage to juggle all the things that you are doing, whether it's, you know, daughter, wife, mom, and then the jobs, you know, whether it's teaching, whether it's the clinical aspect. We'll get into that. I think a few words that come to mind are perseverance and harmony after I finished the book. And at the end, I almost got emotional. I don't usually get emotional, but like when it came, the story came full circle of you finding out that Dr. Johnson passed away. Who was the physician that worked on your mom when she had an aneurysm? I wanted to, this is going to be cut short, but I wanted to read something from the book to the listeners. So in the timeline of things, this is when you finished your residency at Brown with one of your mentors, Dr. Cahill. And you're saying your goodbyes. And this is what he says. So, you are done. I want to tell you some things about our profession that you must hear and that you must know. We are flawed creatures. We make mistakes. We are human. We are also vehicles of God on earth that have been given a very special and unique gift. What you do with your gift is your decision. Never think about this as a job or a paycheck. It's so much more than that. What you have been trained to do is so impactful. Do good work. Yeah. That was my last conversation with him. I mean, since then I've seen him. But you know, that rings true for so many aspects. Yeah. And you know, as you know, in healthcare, we've been through a whirlwind in the last couple of years. We've been through COVID. We've been through, you know, there's been so many barriers to practicing. And I've really held true to that belief that we have a purpose and we have a gift. Yeah. And, you know, it takes a very long time to hone the skills and hone the gifts. And, you know, it's not a job because you're operating on people, you're saving people's lives. I've been personally affected by neurosurgery with my mother's life being saved. And the irony of it is that her surgeon has now left this earth, right? And she's still alive. And so the work that he did continues to live on. And I find that really profound. And I hope that I can do the same thing for other people's families, you know, with the gifts that I have. And so, you know, there's been many times where, you know, I've been disillusioned in my own career and said, you know, what am I doing? You know, what is this for? And I come back to those words that he told me when I graduated. And, you know, I go back to my mother's story. And I look at her thriving, you know, in her 70s with all of her grandchildren. And I think, you know, this could have been for naught if she had been in a place where there was no access to a neurosurgeon. Yeah. In fact, some of the first symptoms that she'd had of the headaches happened to her while she was traveling in India. And I think often... How long before the additional headaches came on after that? It was probably going on for about 4 months. Wow. Yeah. And in fact, she was in India when she remembered she had a very, very severe headache. She thought she was going to throw up. She had gone into the bathroom at this hotel. And I think to myself, thank God that she was in the United States when it happened and she had access to a neurosurgeon who knew what he was doing. Because, she was in some remote village in India at the time, and it was, 20 years ago.
And you've done charitable work out in India
I have. So I have a collaboration with the hospital system out there. And so I go out there every few years and I'll do pro bono cases, adults, kids.
People that would travel across the country to come see you in this 2-week window, right?
It's a 2-week window and they line everyone up. One of the downfalls and one of the things I need to do that's on my to-do list is I need to learn how to speak South Indian dialect, which is Malayalam. I speak the North Indian dialect, so that has put me at a disadvantage with the patients. But, so I've been able to give back. I was in the Middle East operating, different situation, not as much for charity, but, I think that this view of the world and looking at the world is actually a lot smaller than how I viewed it maybe 20 years ago. We're so interconnected. And, I think with the gifts that we have, it's so important to share that gift with the world and to teach and to train people to do what we do and to show them that we enjoy what we're doing, because that I think is key too. There's so much disillusionment in healthcare and medicine now. And, people always ask me, would you tell your own children? I have 3 kids. And it's a hard question to answer, because I look at the landscape of it and I see all of the obstacles and the obstructions. But on the other hand, I see what I've been able to do with my own career and how incredible that's been for me.
What was the common question that you would get about with your kids?
Most of the time, I have 2 daughters and a son.
Yeah.
And most of the time people would ask me, would you tell your daughters to go into medicine?
Okay.
Because of the career path in surgery and, all of the obstacles that are wrought for women who want to have kids. And, and sometimes I'll tell them, my older daughter is clearly more business minded and I think that's where she's going. But my middle one has expressed an interest in neurosurgery. And so what I do is I take them to the hospital with me and they round with me and they meet patients and when they're 16, they're going to go into the operating room, and I want them to see it and be a part of it. And they can decide for themselves, what they want to do.
That alone is a huge advantage. To know someone, I always felt like trying to get observation or volunteer hours was such a hurdle. No one in my family was in medicine. I didn't have like a neighbor or anything like that. It's, I didn't grow up. It wasn't until probably post-college where I understood the value of networking. Yeah. And then these days in the EMT class, I would get students with the sole intention of networking, and they're losing sight of the inherent value of learning something for the sake of learning something. And they're just trying to get another notch on their belt and try to make their resume as resilient as possible, which should be a side effect of doing good work. Yeah. So, your kids are, I'm sure, super grateful for that. And all we can do, I think, when I'm a parent one day is provide all the opportunities, right? And I think, like I said in the intro, what's so interesting about your journey is your ability to balance and take care of your family, as well as give back. Do you feel like you have to wait until you've reached a certain level of mastery in order to give back? Or you've probably given back along the way in any form?
Yeah, I think I really started giving back when I was in practice about 5 years. Because at that point, I was board certified. I had all 3 of my kids. I was at this place where I felt like I could give the knowledge. I had the bandwidth to give the knowledge and take on students. And that's when a lot of women students started coming to me saying, I want to be a neurosurgeon, but I don't know how to do it. And there's so few of you. I mean, at the time, right now there's 219 board certified women neurosurgeons in the US. So we're, 6% of the field. And at that point, I wasn't very involved with women in neurosurgery, organizationally. I was kind of just, trying to understand my own footing in the world of neurosurgery, 5 years in practice. And these students started coming to me and asking, like, I'm terrified of going into neurosurgery. I want to be a mom someday. I want to get married. Like, what did you do? And I had this book that I was writing and writing and editing and writing. And I started writing the book when I was a resident.
Wow. Did it start more of like a journal, or was it?
It was a journal of stories, basically, which is the incredible experiences that were happening to me. And I had never read a book like that. You know, I'm a huge reader. I had never read a book about a woman neurosurgeon who was trying to be a mom and trying to be a wife and trying to be a good surgeon and going through this training phase. And when I got pregnant with my first daughter, Amara, I very vividly remember this episode I had, and I wrote about it in the book, about where I had morning sickness and I was doing a craniotomy.
That sticks out in my memory too.
And, you know, and when it happened, I thought, oh my gosh, like I've never read a book that described this. And so I started writing these stories in a journal, and I just and they were handwritten, and I collected them and collected them. And then here I was, all of a sudden I blinked an eye and I was 5 years in practice. And I had all of these volumes of books, and I had also voice memoed myself.
Nice.
So I had almost 2,000 voice memos. So I thought, what am I going to do with all of this, you know? And then a friend of mine said, well, why don't you hire a transcriptionist? So I hired this woman, and she literally took all of the written and voice data and typed it for me into a Word document. And then I spent the next 2 years kind of shifting things around and creating kind of an character arc of the book. And then, you know, then I had it and I thought, what am I going to do with this? You know? And then kind of almost by accident and serendipitously, if you will, I ended up meeting my literary agent, whose name is Colleen O'Shea, who's this incredible woman. And she was really the one who helped me get a publishing deal and really get the book out into the format that we see. So I think it was hard work, but it was also probably a little bit of luck. You know, being at the right place at the right time and having some of those connections.
Yeah.
So that's really the story, you know, and I think in so many different ways, at some points, you know, I felt like if I never get the book out, it's okay. Like it can sit on my computer. It's fine. You know, COVID happened. I had a really hard time getting a publishing deal. We had a deal, it fell through. And I guess I could say now it was with Harper One imprint. And then it sat on my computer for 2 years. I had no idea what to do with it. And then my agent, Colleen, was like, listen, I think we need to take it back out again. And that's when we got our book deal and kind of moved forward with it.
Did you consider self-publishing?
I did think about it. I just didn't feel like I had the necessary marketing and media aspect to it that the publishers do.
Yeah.
So I felt like I could have very easily self-published it, but then where would it go? So
it has to be read. It has to be seen. That's interesting.
Yeah.
It's worth its salt, though. It's a profound book. It's a quick read, but I think there are so many little takeaways in here. And I think the first half really emphasizes cultivating a purpose. Now, have you thought about what would you be doing had you not experienced the trauma, or had your mom not experienced the aneurysm?
Yeah, I think, you know, I had always wanted to be a neurosurgeon. I think her situation solidified it for me, but I do think I would have gone into neurosurgery.
Okay.
I do. I just think it would feel differently for me.
Yeah.
You know, because the times in my career that I have always felt disillusioned, if you will, or felt like, what's the purpose? I have the purpose, you know, and she's there with me, living and breathing. And for me, it always comes back to the patients. And it sounds kind of corny or trite, but it's about them. I mean, it's about when they come to my office and they're feeling better and I've helped them. And, you know, recently I've had this opportunity to operate on people I know. You know, people who I know are coming to me for their surgeries. And that's actually even more meaningful because those people I see out in the community. I see them at the barbecues and the picnics and the parties and the school events. And, you know, I can watch them thriving. And so those longitudinal patient relationships are really what do it for me. Because I think as a surgeon, it can be very transactional. So, you know, you come to my office, I review your scans, this is the problem, we go to the operating room, we fix it, and then I never see the patient again. Maybe I'll see them a handful of times.
Yeah.
But the longitudinal relationships always have really fueled me because those are the ones where I can really see the difference long term. So that really keeps me going. And I think that's been a huge purpose for me. And then the other thing is learning, learning new things. A couple years ago, I started integrating robotics into my practice, robotic minimally invasive spine surgery, which was something I had only seen at conferences, and once I integrated the robotic platform into my practice and started doing my fusions minimally invasive, that really drove me to want to excel with that technology. So I think the two things for me really, the patient longitudinal relationships, the practice knowledge, technical skills, those two things have always driven me.
Are there any, there's so many different conversations in my head. Are there any ethical conversations with like working on people,
There definitely are.
Yeah.
I mean, and in some ways it's, I hope this goes well because I'm going to have to see them all the time, right? But I think it took me to a point in my career where I felt 100% comfortable taking on somebody I knew, and so in one family, one of my best friends, I've operated on both of the grandmothers in that family. And then I get to see them at events, at book club, at parties, at school events, and they both, and to hear them and their feedback for what they experienced, it's so touching and so powerful in a way that, I don't get to experience with a lot of other patients because I don't know them personally.
Have there been any conversations about out-of-body experiences while you've been operating?
I have had one patient tell me she was awake during the surgery for a period of time. And I know there's literature out there to support that with anesthetics and so forth. But she said she could hear us in the very beginning, and then that was it. So, but out of body, not classically.
Okay. Okay. Like, and then mention things that they wouldn't have known if they weren't awake,
That has not happened to me in my practice, but I have seen a patient, and this is where the mind-boggling nature of the brain comes in. I did see a patient when I was in training who was clinically brain dead. And she'd had a brain aneurysm rupture. She came in as a grade 5 subarachnoid hemorrhage. And we did all the brain death testing on her. We literally did all her brainstem reflexes, the cold calorics, everything. And we're at the point of declaring her officially brain dead. And she woke up. And it's one of the most mind-boggling things that I've ever seen in my career. How you go from that to being wide awake. And I can only explain it by potentially she'd had a massive seizure that kind of knocked out everything, but still. So I feel like I've seen just some incredible things and incredible survival stories.
It brings into question, like, at what point do you actually stop trying as a provider?
Yeah.
Right?
Because we deal with that all the time, especially in the EMT world. It's, So, I definitely think there's mysticism that I've become more open to as I've gone through the years, and one of the things that happened to me very early on in my life was I used to spend summers with my grandmother in India, and she introduced me to this yogi, and I was about 16 years old, and he started taking me through these exercises of almost like a visualization meditation, or like really what he was teaching me was transcendental meditation.
TM.
He was teaching me TM at that age, but he didn't call it that. And that really helped to kind of guide my thinking. It kind of gave me goals, and then I went through actionable steps on how to get those goals. So I think that kind of mysticism that was there culturally for me early on has kind of carried throughout my life. And I strongly believe everything is as it should be and will be. And, if one door closes, I really feel like another one opens. And that's happened to me so many times throughout my life that, I truly believe that there's purpose, intention, fate, but also perseverance and determination.
Yeah, it's tough to think about that when you're actually going through something super tragic, right? Like, when is this next door going to open? But I think at the, this is the Stoicism in me is just like, this too shall pass, right? And it's, as a friend or a family member trying to support, someone else trying to go through hard times, sometimes you can just be there to listen.
Yeah.
Right. I've heard a lot of students feel like they're not going to do well in medical school interviews because they don't have something, like they don't have a traumatic experience to draw from. So if someone lived a pretty mundane life, how would you advise them to cultivate that sense of purpose? Because it's hard to empathize the day-to-day relationships with their patients in each specialty, right? So when someone who's a senior in high school or a freshman in undergrad says they want to be a cardiothoracic surgeon or a neurosurgeon, I don't think they know what they're really signing up for. And I think it's so admirable to have these concrete goals, but what advice would you give them to find out if it's truly what they want to do?
I would say get into the OR, find somebody who's going to take you on as a shadow, spend time in the hospitals, like one of the things I did was I spent my summers in the hospitals, even much before I was even in medical school. I would, one summer I worked in the SPD, the sterile processing department, wrapping trays and putting them in the autoclave. And I learned all the surgical instruments, and, you don't
need a cert for that? A certificate?
No, it was literally just a summer job in college, and I said, I just want to be at the hospital. Like, I just want to see what goes on. And basically just wrapped all the trays, sterilized them, that was the summer. And, get into the hospital, meet people. Are you like them? Are you witty? Is it the same humor? Is it, some of the first neurosurgeons I met, I just knew it was for me because we had the same kind of dry sense of humor. It was, you'll know when you find your people.
But do the cultures shift per specialty, or even does it shift even within each hospital system?
I think probably a little bit of both, but I think there are common threads.
Okay.
I mean, now, I've operated in so many different hospitals throughout so many different health systems and been on staff at probably over 15 hospitals. And I do think there is a common thread in neurosurgery. You may have some variations up and down a little bit, but the personality type is pretty consistent. So I think that, when you find your people, and I would encourage anyone who's unsure to try to get into that specialty with those people. Now it's so easy with social media. Back when I was at this stage, I didn't know how to contact a neurosurgeon. I didn't know any neurosurgeons. I didn't even know where to begin. I mean, now you can literally go on to Instagram or LinkedIn or any platform, identify who you'd like, send them a message. And I've had so many students contact me through that, and many of them wanting to get involved with women in neurosurgery. And I've put them in through the the pipeline to get volunteer positions and things like that. So, I mean, I think it's so much easier now than it used to be.
What if someone were to pursue the cold emailing? I feel like there's a better way to do it in the sense of just not asking for an opportunity, but wanting, what type of value should they propose to make it worth their while? Is there anything that they could propose to make it worth the mentor's while? I
think some of the things are research opportunities. So people have reached out and said, hey, I'd really love to be on a research paper that you're writing, or a clinical paper. And so some of those students I've taken on, and because there's always papers to write. We see things all the time, and we just don't write them because we don't have time. And so you get a good student in there who, wants an opportunity or wants to apply and get a first authorship. So I've taken on some research students that way. Recently, I've become involved with a global organization. I'm on the scientific advisory board. So now we're taking international students.
Oh, wow.
That's more to fund their education, but also provide opportunities. So we're looking to basically take students from underserved parts of the world, fund their education and give them access to training in the United States.
Yeah.
And the hope is that they take the training and the skills and then they return to their home countries to build neurosurgery programs.
I would love to do something like that with the EMS.
There's so much opportunity. I mean, we are so global. We are so interconnected now more than ever. I mean,
Right.
you know, there were times in my career I wanted to do something like this. I just didn't have all of the moving parts in place, and we finally do.
Wow.
You know, we're doing conferences. We're going to conferences in Saudi Arabia and Qatar and Dubai, Abu Dhabi. It's meeting colleagues that do what we do, bringing robotic spine surgery there. So there's just so much collaboration, I think, that didn't exist, you know, many years ago. So.
Also, through the first half of the book, you described many obstacles that you had to face, whether they were directors of residency programs or even like just examples of not wanting to show weakness in the OR. So the morning sickness one came to mind. Like, have you gone back to that? And just like what, even like now as a practicing neurosurgeon, like what happens like if someone shows weakness? I think this next generation is more open to communicating at least about what they're going through, right? And relating to each other. And when you start to talk about it, you realize more people like relate to you.
Yeah.
In that way.
Yeah. And I think it's, you know, it's interesting because I'll talk to, you know, women neurosurgeons or women who want to go into neurosurgery, and they'll ask me about maternity leave and things like that. And, you know, with my first daughter, I mean, I took off 6 weeks and there was no maternity leave policy. I wrote the policy. They didn't have one. You know, they had never had a resident that there was no policy, you know? And so, you know, and with my son, you know, I had basically had 2 weeks off. You know,
in the book you said 4, I think.
It was somewhere between 2
only
to 4.
2?
Yeah.
I was like, only 4?
Yeah. And you know, it's amazing because people look at that now and they're like, that's insanity. You know, because that's just not how the world is now. I mean, now, even for women residents who are pregnant, they get, you know, a nice enough chunk of time off. So, you know, I think I kind of came through the fire at maybe a time where it was less popular to be a neurosurgeon, or there was less conditions, or less, I guess, you know, people just assumed.
Yeah. Okay.
That
Less
you were going to
pathways,
just tough it out. But I think one of the dangers in the profession, and I'll say this across the board, not just neurosurgery, but across the board, is I think sometimes, you know, the expectation that you're going to be able to show no weakness and you can't show fallibility is what drives people to many things like alcoholism and drug abuse. And, you know, and I've seen, unfortunately, many people in my career, mentors, people that I've, you know, really looked up to as super incredible, brilliant surgeons who have fallen off of the pedestal because they've driven themselves so hard to success. And that's been a big takeaway for me, watching some of these people throughout my career and knowing that I needed to have a good balance in my life. You know, I mean, you can't just be the super successful surgeon, researcher, and then your whole family life is falling apart, you know? And so for so many, that's what I did see.
Yeah.
Or the opposite, you know? So I think that really helped to allow me to find the harmony, find the balance, look at the things that drove me. What am I passionate about, you know? And I'm passionate about teaching. I'm passionate about global neurosurgery. I'm passionate about bringing opportunities for students in underserved areas that don't have them. And, you know, this concept of, even in like a place like Chicago, I mean, taking a child that needs an education and sponsoring them for that education and having the ability to do that. And think about like the trajectory of their life and what you're going to do with that person, you know? And so that really inspires me at this point in my career, is really
planting roots.
Giving
I
back.
think you described it in the book as that, right? Just like
Planting
looking at
roots.
a tall tree, but like seeing what's under the like thinking about the roots of that tree and like how many touch points were involved in helping that tree grow to as tall as it can be.
Absolutely. And I feel like, you know, I stand here now as a product of all of these people that have poured their love and their affection and their education into me, you know? And so I think, from a spiritual mysticism standpoint, Hinduism, we always say, and it's always a belief that at this kind of third stage of your life, you give back. And that's when you've made it, and now it's time to give back to others. And so I feel like I'm kind of in that stage right now with the book and with so many other things that, I'm involved with. And it's a good place to be, because I didn't get there on my own. I got there with a lot of support and a lot of direction from many people.
On the flip side, that director of a residency program that, outright told you that, this field of neurosurgery is for, I don't know if he said white male, but definitely said male. And you were just like dumbfounded, like at a loss of words. And he showed you the door. All you did was walk out. You're like, what the heck just happened? Yeah. Alex was, your husband was dumbfounded. We're like, what? Like, no one can speak like that. And realizing that, Alex has never had to experience something like that. That being said, I keep thinking, like, why do these attendings, not like all attendings, but like, why do attendings pass down that generational trauma to their residents?
Yeah, I think it's one of these abusive situations where, they've been abused, and so they pass it down the line. And I think it's a bad cycle, to be honest. In some ways, I think they believe it makes you tougher, it makes you stronger. And like one of the things I hear now is, oh, everyone is so soft, right? The residents are so soft. And maybe that's true. But, on some level, I still think they're very well trained. I still think they know right from wrong. I still think they have values. And the world is a bit different than it was, 20 years ago when we were going through all of the training. I think we all went through a lot of trauma back then that maybe we don't always talk about or bring to light.
Yeah.
I've definitely met with other women neurosurgeons who are kind of one generation up from me, who are still dealing with the, things that they experienced in their residency and trying to find a place for those things.
What would you like to see? Even like I remember you saying Dr. Cahill never really opened up to you until the very end of your residency. Are there moments... It's tough. It feels cutthroat at times, but like, are there moments where you can be candid with your peers and your superiors in residency? Are there opportunities to just be vulnerable?
I think yes and no, and I think it depends on your program, quite honestly. Unfortunately, many of the neurosurgery programs are not soft, kind, gentle places. I mean, they're places where, when I started at Brown, the program director, who was the general surgery program director, because that's how I started in, had said, we're going to pound you into hard steel by the end of the training, and by the time I was done with the training, it kind of felt like that, So you do, but do you need to be so hard in order to be good? And that I think is a key question. I've met some brilliant people in the field that are softer, kinder, gentler, but are still very focused on quality of care and patient care. So I don't think you necessarily have to be pounded into hard steel to be good. I think what it does do, though, is it does make you tough, and you do see such a variety. I mean, being on call for 36 hours, you put your body through... It's a different level, of work, and
you're mentally fatigued, and then you're physically fatigued.
It really, it's really, and I will say this now because I've been in the field long enough. Like, sleep is a basic human right.
Yeah. Well, what does that say about patient care if you're sleep deprived?
Well, and that's the thing, it's what mistakes are we making because we're not focusing, or we're in the operating room at 2:00 in the morning. And
so why can't there be more room for residents? Why is there such a shortage of residency placements?
I think a lot of it's just kind of controlled by, the ACGME and these organizations that limit the spots.
It's not the individual programs?
It's not the individual programs. Yeah. It's actually regulated by the ACGME that regulates.
Oh.
So it's really not a programmatic. It's how many you're allowed to take.
That's so backwards to me.
Yeah. Because you have to have the number of cases to support the graduate.
I understand that. Yeah. I understand that. So what if there were more placements, each resident wouldn't get the quality experience that they need to be a great attending.
Right. The case volume. Yeah. So.
And no one would want to do more years. More than 7 years, right?
I think 7 is enough.
Dr. I don't know if you know Dr. Stephen McGill, but he said the same thing. He's like, it's tough to, like, he's like, looking back, he's grateful for the 7 years, because there will come a point where, people will rely on you to fix their loved ones. And you want to be the best, provider you can be.
Yeah. Yeah. I agree with that.
Is there anything else, like, if you were in a position to, and you are in, like, the day-to-day, I think you had a profound impact on the medical student that fainted in the OR, and the softness and the gentleness, like, of, hey, it's okay, and you taking the time to listen, something that I'm sure they had to work up the courage to even, like, talk to, will leave such a profound impact on that. But is there anything else you would change about the process about becoming a neurosurgeon?
It's a hard question, I think I've learned to kind of put a lot of the things that bothered me about the training and what I went through with the pregnancies and so forth into book form, and because that's my catharsis, that's the way of me writing it down. I think the field has just incredible, brilliant, gifted people. But the field also has a lot of very arrogant and pompous people. And I think that's our problem as neurosurgeons. It's that we don't open up our hearts enough. We open up our minds, right, all the time, right? We're examining patients, we're discussing surgery, but we don't open up. We don't have that warmth factor. Many neurosurgeons I know don't have the warmth factor to patients. And that's, I think women neurosurgeons, I actually have a lot of female patients, but a lot of male patients too, because they can be vulnerable sometimes. They can open up about what's happening with them.
Yeah.
And
yeah, I was going to ask, like, what does a female perspective bring to the specialty?
I think it's different.
Yeah.
I do. I mean, I think I spend more time with my patients. I'm told I listen to them more. I've been in rooms where I've examined patients or I've talked to patients with my colleagues sometimes. It's a different conversation. It's a different feel. And I think many times when I've seen male neurosurgeons speak to patients, it's more dictatorial. It's more, this is what we're going to do. And, but I feel like when I speak with the patient, it's more conversational.
Yeah, it's a discussion.
It's a discussion. Yeah. It's what do you think is going to be a good avenue for you, and here are the options for you.
Okay.
So it's just, a different feel, I think. And I hope that the career, and I hope that the profession, becomes more open-minded about having dialogue with patients rather than it being, this is what we think is the good idea, this is what we're going to do, and
I think that's most pre-medical students' perspective of wanting to get into this industry, is just like wanting to help people. And I through this EMT class, I try to help them make an informed decision on if healthcare is the vessel that they want to help people through. Because many industries can help people, but do you specifically want to help sick people, and specifically in maybe the pre-hospital sense or the ED? And then through that is a stepping stone into meeting other specialties and things like that. I think two of the things that if people read this book could potentially change the specialty, maybe implementing maternity leave for other residency programs, as well as maybe implementing a meditative timeout pre-surgery. I think you mentioned it in a podcast. Is that a consistent ritual, or kind of just like, was that a one-off thing that happened with you?
It was a one-off.
Oh.
Yeah. Now, I will say, though, I am a huge believer in everybody kind of having a collective hive mind, if you will.
Yeah. On what we're here to achieve.
What we're here to achieve,
you
know. I mean, I think it's, if everybody were to take we do our timeout, right, for the patient. We talk about the procedure. We talk about the laterality. We talk about who the patient is. If we all were to take, 1 minute and just in our minds or together collectively say, we're here for this patient to do so-and-so's operation, to do an excellent job for her or him.
Yeah.
You know, and then let's dive in. And I think that collaboration is so important, that we're all in it together, you know, because at the end of the day, we really can only rely on one another, you know, and so I think I'd like to implement that moving forward. It's a great idea, Victor.
I love it. I think, I mean, so I didn't tell you pre-recording, I'm an anesthesia tech at Northwestern as well. I don't see the meditative timeouts too often. The standard timeouts, but which, you know, does its thing. It gets everyone on the same page. But in the spiritual sense, there's something special about a little close your eyes and head down and just kind of everyone's on a similar wavelength, I think, afterwards.
Yeah, I think so.
But on the flip side, I think you still continue to do some type of meditation for yourself, though.
I do. I'm a huge believer in meditation. I do a lot of yoga.
Yeah.
I do other things too. I mean, I'm a runner, I swim, but I think the yoga and the meditation have been really consistent for me, and things that I've carried through in order to balance the stress and, you know, bring the harmony to my family, and so that I'm in the right mindset where I'm not coming home, you know, stressed out from the day. So I feel like, you know, when I walk in the door, I try to be, you know, the wife, the mother, all of those things. And I try to leave the stressors of what took place in the workplace behind. And, you know, I still work at it. It's a constant balance.
It's hard, especially with social media and stuff. I think when we talk about balance in this episode, and as it should be in every sense of the word, is you're not sacrificing, you know, or you're not giving 50% to work or 50% to your kids or to Alex or to whatever. I think what you mean is you're fully present in whatever you're doing at this very moment in time. And when you're not there, you do your best to be present on something else.
Yeah, that's really what it is.
Did that come naturally to you?
I worked at that. You know, because there's so many distractions.
Yeah.
And, but also I think deep down knowing that you can do it all. Like you have to have this idea that you can, because if you start thinking you can't, then it's all going to go haywire. You know, I mean, you have to have the mentality that I will be able to achieve all these things. And like, I'm going to be able to achieve all these things. And you have to be strong, you know? I mean, the world is going to throw curveballs at you all of the time, and you're going to have to navigate through that. And it's exactly what I tell my kids now, you know, it's like, so, I mean, and with that being said, you know, I look at the obstacles that I've come through, and I think it's nothing compared to what some of the women and girls across the world are going through. You know, I mean, I saw this profound interview with Malala when she said she woke up one morning and the Taliban had taken away the right for education for girls. And I think about that, and I think as many obstacles and hurdles, and as much as being told you can't be a neurosurgeon because you're not a white male, and that stung, you know, and so many of those things, but still, I'm so fortunate to be in the United States and have that ability to go to school, you know, and so, you know, one of the big things that I have on my docket for the next 10 years is really trying to help these women and girls to really elevate themselves and get their education in these underserved areas. So it's been a really big thing for me.
Anywhere, like locally and abroad, or in a specific location?
I mean, right now we're doing this international outreach. So it's really about looking at these places that are very remote, that, you know, they're looking to be trained in the U.S. and then sent back to work.
So what does that mean? They don't have to become board certified, or do they, like, you go all the way to become board certified and then go back, or how does that work?
You would basically, well, and every country has different specification for boards.
Okay.
India is different, Middle East is different.
Yeah.
So basically you would come to the United States to do a portion of the training and then go back and finish out in a home program and then, you know, operate.
So there's a lot of communication between other programs, like international programs then? Oh, wow.
So
that's great work.
That's the next 10 years for me.
Leveling the playing field.
It's really about taking people that don't have the advantage, giving them the advantage, and then allowing them to go back to their home countries and provide that good service, that wasn't available, the access that wasn't available. So, that's really what drives me. That's my purpose. It's, wanting to make sure that, every female child or woman, has the ability to go get their education. And it's not a privilege, it's a right. Mm-hmm. Mm-hmm. So, I'm excited to see what the next 10 years are going to be like,
Yeah. The disparities are mind-boggling with the, specifically just like the amount of things that we waste at the hospital. Providers might open things just in case of an emergency, and those emergencies don't happen, and in the trash they go. And very rarely there would be, anesthesia providers, surgeons that might collect a trash bag full of things that might be open but unused, and they would go back and do these mission trips. But why isn't there an ongoing maybe protocol of like, hey, there are places that could be using these things?
Yeah.
I don't get it. The fact that we have disposable laryngoscopes, video laryngoscopes like that are disposable these days is mind-boggling. The fire department I used to work for, we would just sandy wipe the blades. And that was right around the time where we started getting disposable blades. It's insane.
It's really insane. And when I went to India, especially, I realized just, how enormous it was. I had a patient that I was operating on in India, and they had an incision. It's called a bicoronal incision. So essentially from ear to ear. And I had to close it with one stitch, the entire incision, and
one glove.
One glove, one set of gloves, one stitch, it's like, can you do it? And so you just realize like how wasteful we are in the US, and, the hospital in India didn't even have air conditioning, and so we're so privileged to work in the United States and have all of these, bells and whistles.
Do you pass that down when you're training someone here then?
I do. And I also am very careful about what I use in the OR. I typically don't have them open a lot of nonsense and extra stuff. It's like, please don't open 3 packs of sutures. Like, I will tell you exactly what I need, And so, in fact, somebody the other day at the hospital said, wow, Dr. Dewan, we're so excited that you cost save for us here. But it's not even so much about the cost. It's about like the waste, It's like, I don't need this entire pack open. I will tell you like the 6 things I need. So, I think that's really important. And in fact, one year, this is many years ago, we actually did what you were describing. We saved all of the extra supplies and we sent them to India.
Yeah.
So we did that one year. But again, it was kind of a one-off for us, and I think that what I would like to see is that we do that more often.
I'm constantly throwing stuff out, so yeah, I would be happy to be part of that process of like, let's start collecting for providers or places that could be of use, could use them. Wow, I do want to touch on your mom. What exactly did she do here? I haven't heard too many. Who's first generation? Is she first generation or are you first generation?
So I'm first generation.
You're first generation. Yeah. She was the highly ranked like academic PhD, and she would go abroad and what did she do? And I guess, so what did she do?
So my mom was a political science professor.
Yeah.
So she had her PhD in political science. And she actually had 3 masters. So she had a master's in Indian studies. And so she basically, her thesis and her PhD thesis was about looking at the Indian diaspora. So essentially all of the non-resident Indians that have left and you kind of where they have been located and what they're doing with their lives.
So the master's was here?
She did, yes, she did one of her masters here.
Wow.
Yeah. So she used to take her students on field study trips to India and show them India. And they were really profound trips. You know, these people would come back just transformed from their experiences. This is 20 years ago. So our traveling around globally wasn't as common. And, you know, she was really, when her aneurysm ruptured, she was kind of at the peak of her career.
Oh, wow.
She was 49 years old. She had just been nominated Woman of the Year. The Chicago Tribune had just done an article on her, and, you know, she was at the top of her career. She was very active. She was on multiple charity boards. And, you know, one fine morning, she develops a, you know, severe headache and gets taken to the the emergency room, and that's where she was diagnosed. And that's kind of where the story started with, you know, Dr. Johnson. You know, it's really night and day, I think, and anyone whose family has been affected by neurological trauma or stroke, I think there is a clear before and after.
Yeah.
You know, there is the person who you knew your whole life, or what I had known of her my whole life up to that point, and then there's the person afterwards. You know?
And this can be how they function on a day-to-day, as well as maybe sometimes personality changes?
I think it's both.
Okay.
You know, I mean, she very much changed cognitively. She was a voracious reader. She had written her own book. She had a very hard time concentrating after the stroke. Even now, you know, she's only finished 3/4 of my book because it's very hard for her to process and come back to it. You know, one of the things about neurologic trauma and neurologic injury is that from the outset, the person can seem very normal. So you look at a person in many ways and you can't see the deficits. And I will say with her, I mean, she's come such a long way. I mean, she's, you know, functioning, driving, doing everything, but she never went back to her profession. I mean, she couldn't. So I think there is this clear before and after that happened with her. The person who I knew, the person who she became, she was incredibly independent, driven, ambitious, and you know, she became more docile, more pensive, more, you know, let my dad do a lot of things for her type of person. So, you know,
what did she do? So she didn't go back to work at all? And what did she?
She didn't. She retired.
Interesting.
Yeah, she retired, and you know, at that point, just became more small volunteer positions here and there, but she couldn't. I think from a stress standpoint, just couldn't do the things that she was doing before. She couldn't lecture for 4 hours, or you know, take a group of 50 people on a field study abroad, and it's her ability to do that wasn't there.
Have you guys had conversations about what she wishes she could do?
You know, sometimes, and in the beginning, she went through this "why me" phase, you know, and she'll say it. I mean, she's very open about it, and she'll say, you know, for the first almost 2-3 years, it was, why did this happen to me? Like, why have I become like this? But then it kind of transformed into, you know, being a grandmother and being with her grandchildren. And so I think it kind of meandered naturally in some way.
So coming to a sense of gratitude for being able to be a grandmother?
To be able to be alive.
Yeah, yeah.
You know, I mean, I think it became why can't I have a full career? Why am I so dependent on everybody else? To, I'm living. You know, I have a pulse. I can be with my family. I can be a grandmother to my grandkids. I can see my daughters get married, you know. So I think it really transformed for her.
It's tough. My parents, my dad just retired, but his identity is very tightly wound to work. And, you know, he's only been retired for, you know, maybe not even a year. But he doesn't have any hobbies. So it's interesting seeing him maybe find himself again. Or his identity was also closely tied to his kids, but now his kids are grown and independent. What now? You know, go find what brings you joy, right? Yeah. And as much as our kids want to be seen by their parents, I think our parents want to be seen by our kids too. And I hope she knows that you see her, right, in all her glory.
Oh, absolutely. Absolutely. She knows it, you know, and I think the book was really hard for her to read, the very beginning part, because I think she was in such a state, she didn't really know the effect it had on everybody else around them, everybody else in the family. And so I think it was kind of cathartic for my parents to read the book and my sister and kind of go back to that time, which was probably the hardest thing I've ever had to deal with in my adult life.
Yeah.
So.
What other effects did it have on your dad? Did he have to give up work at all for a little bit, or?
No, he continued on, doing what he was doing. But I think, for a woman who was very independent, she became very dependent.
Sure.
And that was, I think, a big change for him because, it wasn't really the person who he had known,
How, if it has it shaped how you'll parent your 3 kids, as far as how much emphasis you put on cultivating meaning through work?
Yeah, I think the kids, they realize that I do meaningful work.
Yeah.
I mean, they go to the hospital, they see patients, they've rounded with me. We've had patients deliver flowers to the house or chocolate, or the ones that I've known. They see the letters that people write me. And so I think they know what meaningful work is. It's, my thing with them is I want them to know that no matter how busy I am, I'm always there for them, just in the same way that my parents were there for me, and it's if I called my parents at 2:00 in the morning and said, I need you, it wouldn't even be a question. They would be over, and that's the type of upbringing I want them to have with me.
Another way to balance life is to have as many different facets of your life overlap. Have they come on, in addition to rounding, but trips abroad?
Yeah, they have. They go on trips abroad.
I think it's witnessing these disparities as a young kid that can help shape your perspective.
It is, and I grew up in the Middle East. So interestingly enough, I was born in Illinois, and we moved to South Korea when I was young, and then we lived in the Middle East for a long time, and then moved back to the U.S. And so I kind of saw this global perspective of how women were treated, how doctors were, what doctors were. They were men, they were women. I've taken the kids to India, so they've been able to kind of witness it. And one of our last trips, they had gone into kind of more of like a slum type of area, and where people were living in shacks down by the river. And this is when we were in South India, when I was on my charity, doing a charity work. I brought them with me. And, it was interesting. They didn't really process it or say anything about it until we came home. And they said that was really sad. That one room was their house. And so they try to find a place for it, in their heads. And, and I really encourage them to look beyond what they know, and look to do work in the world globally and internationally, and, touch people's lives and be connected.
I'm sure you also get comments here and there of, there's so many people locally that need help. And it's just like, well, you can only do so much, and you try to utilize and leverage the skill set that you have with your purpose and do good through that vessel. And it's hard to save everyone, right? It's even as a healthcare provider, it's like, you can't save everyone. You can do your best, but that's just not realistic. Yeah. Mentally, how has that taken a toll of like what we're currently experiencing with the migrant issue in Chicago? Do we even have the bandwidth to spend time acknowledging, thinking about it, or it could be the Ukrainian war or the Palestinian conflict? Like, do we have the time to just think about it, or we already have a full plate?
Yeah. It's such a great question, because I go back and forth about that all of the time. I feel like I want to know more. And then there's this part of me that says there's so much to do here that, even in Chicago, so I think not being ignorant of what's going on around you is the number one goal, right? You can't turn off the news and say, I don't want to know about it because it doesn't affect me. Because it does, and so I think ignorance is not bliss. I think, we can't be ignorant about what's happening in the world. We are voters. We have a voice, and, we need to be involved even politically to know who we're electing into positions, mayors, aldermen, down to those levels, the people that support our causes and the things that we want to do in our cities and our homes. So, and that's one thing I learned a lot from my mother, her being a political science professor. It was, you're a voter, you have a voice, and, you need to know what's happening around you. So, I think the downside and the hard part, especially with some of the wars, is just seeing the images and, what's on social media and how that affects you, from a brain standpoint. And so I think, because we are so interconnected and there are cameras in places, that can be really hard,
Yeah, I think that's all you can do is like not be ignorant to it. And to me, it's like realizing what's in your control, and your family, your work, charity, anything outside of that is within your control. But I don't know. Yeah, I guess it's like if you find yourself consistently outraged without an actionable plan, is it doing any good?
Yeah.
I don't know.
Yeah. I mean, I would say you have to put, action behind words. If you have the words and you feel strongly about something, I think put the action behind it. And, and I think there's ways to do it with organizations. There's ways to do it, even grassroots, one of the things, and on a smaller scale, was when I started with women in neurosurgery, we had all these voices, strong voices, powerful voices, but nobody knew who we were, and so I took on starting the social media for women in neurosurgery and, became the chair of the outreach program, got the word out, about who we were. And so I think you have to take steps. If you see something that isn't right or something that you think could be improved, I think it's important to kind of challenge ourselves to do that.
Yeah. You spoke about your 10-year goals. Any 1 to 5 year goals?
So I actually have another book that's going to be coming out. Yeah.
Oh, what?
Yeah. So Cutting a Path came out in May, and very excited. I have written another book. It's actually a children's book.
Oh, cool.
Yeah, it's a middle grade fiction book about a female tiger growing up in the jungles of India. And it's about this tiger and how she experiences poachers and deforestation. And I actually started writing it when, Tiger King had kind of come out. I wrote it before that, but then Tiger King had come out. So it's kind of explosive, But anyway, this book is really special to me because I wrote it with my kids.
Oh, amazing.
So my kids are my co-authors on it. And
my goodness.
It's illustrated. So, all of the characters and the stories and the storylines and the character arcs are all thought of their brains, and it's all processed through them.
Yeah.
So I'm really excited about that book. We're just putting the finishing touches on it. And hopefully it'll be out in probably late 2024, maybe 2025.
Amazing. Congratulations.
Thank you.
It made me think of someone else who's been on. He's a local urban historian, Sherman Dilla Thomas. And he said something in the episode along the lines of, don't check people you haven't been checking on. In relation to the crimes that's been going on, it could be like just mobs of kids going through downtown Chicago, or people stealing catalytic converters, or just, carjacking people, porch pirates, just those things. Crimes committed by most of the times under 18. And, we're talking about the police not doing anything, with the police, them not being able to do anything because these kids just keep being re-released. And Sherman's response to that was, have we been checking on these people, on these kids, at an earlier age? It's and so writing a children's book, planting the seeds at such a young age will leave a profound impact as they start to think about what they are interested in.
Yeah, do they want to be writers? Do they want to, but then, I'll come back to, what we can give these underserved kids. Because, I mean, you take one of those kids and you invest in them with their education and food and clothing and shelter and even just the basics. And I mean, what they're going to be able to do is remarkable, you know, and I wish we had more organizations that invested in our kids and their education. So, you know, I'm excited for what the future brings for, you know, for my family and my kids and their goals and writing a book and, you know, being authors and kind of seeing where the world takes them.
Yeah.
You know, but I want to give them all of the experiences. They've actually been on book tour. My daughter came with me to New York and we did a talk. I did a talk at Lenox Hill in Manhattan, and she came with me, and it was just wonderful.
How old were they at the time?
So she's 13.
Yeah. That's a good age.
And, you know, she flew out there and got to experience it. And there was another conference in Chicago, the Women in Medicine Summit. There was a book signing. They came there, and so I want them to be a part of everything I do, all aspects of it, you know, to be able to really decide for themselves, what do they want?
Yeah.
You know?
Yeah. Well, it's nice to hear that, in the sense of sometimes we get phone calls for the EMT class from parents, and sometimes it seems like the parents are more interested than the kids. And it's just I remind them, like, well, you know, the kids should be just as interested, if not more interested in this stuff or whatever they want to be. And all we can do as a parent is provide the opportunity. Yeah. So to bring it back to neurosurgery, I guess one question I really wanted to get from you is just, you know, why, you know, when you're, as far as surgery, why specifically neurosurgery instead of, let's say, cardiothoracic or ortho or plastics or ENT? Like, what about neurosurgery is it that you aligned with?
I think, you know, I was just fascinated by the brain. The brain was just this awe-inspiring organ, you know, everyone's, you know, your thoughts, your hopes, your dreams, and being able to operate in the brain, it's just almost fantastical. If you think about, you know, Harvey Cushing, who was one of the first neurosurgeons who documented his findings, and you learned how to use antibiotics. And, you start looking at these neurosurgeons that have gone through time and realizing just what pioneering work they did. And it was a leap of faith, you know, for so many of them. And people didn't believe in them. People thought they were crazy, you know, but they did it. And we, you know, have them to thank for all of this knowledge that we have. And so, you know, I think it was the brain, really.
Okay.
It was neuroscience.
Okay.
It was just this fascination. And also, I think, wanting to do one of the hardest things that I could push myself to do.
Sure.
So, and I think that's really what it was. And it still is, you know. I mean, I think now I do work in the brain, work in the spine, you know. Spine surgery, I think, was something that had never been a huge interest for me going into neurosurgery, but it's a part of the training. And, you know, somewhere in my career, the spine surgery aspect was fascinating with the robotic technology and endoscopic. And I do a lot of my work minimally invasive now, you know, through small tubes. And it's just fascinating. You know, you can take out a herniated disc.
Yeah, I gotta send my buddy your way. He on a what seems like a weekly basis gets steroid injections in his back. And I know he doesn't like take the time to rest, which could be helpful. But I wonder if surgery is an option, if he's open to that.
Yeah, I mean, happy to see him. You know, see a lot of patients who are looking for, you know, both non-invasive and invasive options. You know, and kind of talking to them about all the things that they have. And so I think, you know, with neurosurgery specifically, it's just, you know, the passion for the brain, the passion for technology, the passion for advancement. Those are my big drivers.
Have you thought about, from the emergency medicine standpoint, what pre-hospital providers could be doing more to improve outcomes by the time they arrive to the ER? Or is it just simply recognition of a potential stroke? Is there any other type of assessments that they could, outside of the stroke scales, that they could be performing to give more details, I guess?
Yeah. I mean, I think a very quick, simple neurologic exam, you know, would save lives. It's really, you know, there was a story that from early on in my career, I had a young girl who had gotten into a biking accident, and she, you know, had got into this accident, was riding her bike, no helmet, and had gone home and started vomiting. EMS were called. By the time she got to the hospital, her pupils were, they were basically asymmetric. And at that point, the minute the pupils are asymmetric, that's the time for the action, And so I think pattern recognition, and by the time her pupils became, asymmetric to the time that she became obtunded or basically in a coma was, about 15 minutes.
So pupils are a pretty late sign?
They can be. They can be. But I think, that's the recognition. It's the same thing with strokes, and you see these signs for stroke. It's make sure you get them to a hospital. Are they a candidate for TPA? What's the next step?
When you say stroke scale, is the Cincinnati stroke scale sufficient?
That's typically the one we use.
Okay.
Yeah.
Okay. Because I know there's so much more when neuro is called down for a consult, and there's like so much more, but I wonder if any of that would have been helpful in the pre-hospital sense. And I think a lot of the work comes from not only recognizing the stroke, but transporting to the appropriate facility. Yeah. And that's what I tell our students, whether it's cardiac and going to a cath lab or neuro, going to a stroke center, and differentiating comprehensive versus primary, like that's what separates a good EMT from a great EMT.
Yeah, no, I 100% agree.
Is there anything else you would like to share that we haven't touched on, Dr. Dewan?
Oh, let me think. No, I can't think of anything offhand. I think we've had a really nice conversation, and I really thank you for having me here to come chat with you and talk about the book and goals. And I think, I really hope that this conversation is inspiring to people and helps them look at their own lives and their capabilities.
Yeah.
We're incredible human beings. We have incredible thoughts. We have incredible dreams. We're so capable. And I think if there's one takeaway from this conversation, it's that we all have the ability to do incredible things. We just have to believe in ourselves.
Nothing's impossible.
Nothing's impossible. I've proven it.
Where can people find you if you want to be found?
So you can find me on Instagram at Dr. Sheri Dewan. I'm also on LinkedIn. And if you want to send me a message, you can go to my website. Very easy. It's www.drsheridewan.com. And if you'd like to buy a copy of the book, you can do it on there as well.
It's a good book, guys. Great book. Thank you, Dr. Dewan. For everyone else listening, stay curious.
Thank you.